Stop choking before it starts, life-saving tips for parents. Today we're talking about something super important for all parents, grandparents, and caregivers: how to prevent choking hazards in babies and children. Choking can be really scary, but the good news is, most of the time, it's totally preventable. So let's break it down in a simple, conversational way so you can feel confident and prepared. First, let's talk about why choking is such a big deal for little ones. Babies and young children have really small airways, and their bodies are still learning how to chew, swallow, and breathe properly. Plus, they're naturally curious. They love putting things in their mouths to explore the world around them. It's how they learn. But that curiosity can sometimes lead to dangerous situations if they put something too big or unsafe in their mouths. Choking is actually one of the leading causes of injury and even death in children under the age of 4. But don't worry, with a little knowledge and preparation, we can prevent most choking incidents. So, let's start with food. Food is one of the most common choking hazards for babies and young children. When you're introducing solids to your baby, it's important to make sure the food is prepared in a way that's safe for them. For example, foods like grapes, hot dogs, and nuts can be really dangerous if they're not cut up properly. Grapes should always be cut into quarters, not just halves, because they can still block a child's airway if they're too big. Hot dogs should be sliced lengthwise and then into small pieces. And nuts? Well, it's best to avoid giving nuts to children under 4 altogether because they're hard to chew and can easily get stuck. Another thing to watch out for is sticky or hard foods. Things like marshmallows, gummy candies, and popcorn can be really tricky for little ones to handle. Marshmallows and gummy candies can get stuck in their throat, and popcorn kernels are just the right size to block their airway. So, it's best to avoid these foods until your child is older and can handle them safely. Now, let's talk about how to prepare food for your baby or toddler. When you're cooking or serving food, make sure it's soft enough for them to mash with their gums or teeth. If you're giving them something like carrots or apples, make sure they're cooked until they're soft or cut into tiny, manageable pieces. And always supervise your child while they're eating. Even if they're eating something safe, accidents can happen, so it's important to keep an eye on them. Okay, now that we've covered food, let's talk about toys and small objects. Babies and toddlers love putting things in their mouths, so it's really important to make sure their toys are safe and age-appropriate. A good rule of thumb is to avoid toys with small parts that can fit through a toilet paper roll. If it can fit through the roll, it's too small and could be a choking hazard. Always check the age recommendations on toys. And if you have older kids in the house, make sure their toys with small parts are kept out of reach of your little one. Household items can also be a big choking hazard. Things like coins, buttons, batteries, and even small magnets can be really dangerous if your child swallows them. Batteries, especially button batteries, can cause serious harm if they get stuck in your child's throat or digestive system. So it's really important to keep these items out of reach. Make sure to do a regular sweep of your floors and furniture to pick up any small objects that your child might find and put in their mouth. Another thing to be aware of is balloons. Balloons might seem like harmless fun, but they can actually be really dangerous for young children. If a balloon pops, the small pieces can easily be inhaled and block your child's airway. And deflated balloons, those are just as risky. So it's best to avoid giving balloons to young children altogether. Now, let's talk about what you can do to create a safe environment for your child. One of the best things you can do is to get down on their level, literally. Crawl around on the floor and see the world from their perspective. Look for anything that might be within their reach that could be a choking hazard. And don't forget to check under furniture and in between couch cushions. Small objects can easily hide in those places. It's also a good idea to teach your older children about choking hazards. If you have older kids, explain to them why it's important to keep small toys and objects away from their younger sibling. Encourage them to help you keep the house safe by picking up their toys and putting them away when they're done playing. Okay, now let's talk about what to do if your child does start choking. Even with all the precautions in the world, accidents can still happen, so it's really important to know what to do in an emergency. If your child is choking, the first thing to do is stay calm. I know, easier said than done, but staying calm will help you think clearly and act quickly. If your child is coughing, that's a good sign. It means they're able to move some air. Encourage them to keep coughing to try to dislodge the object, but if they're not able to cough, cry, or breathe, you'll need to act fast. For babies under 1 year old, you'll want to use back blows and chest thrusts. Place your baby face down on your forearm, supporting their head and neck, and give 5 firm back blows between their shoulder blades. If that doesn't work, turn them over and give 5 chest thrusts using 2 fingers in the center of their chest. For children over 1 year old, you can use the Heimlich maneuver. Stand behind your child, wrap your arms around their waist, and make a fist with one hand. Place your fist just above their belly button, grab it with your other hand, and give quick upward thrusts. Keep doing this until the object comes out or until help arrives. It's also really important to learn infant and child CPR. Taking a CPR class can give you the skills and confidence you need to handle a choking emergency or any other situation where your child might need help breathing. Many local hospitals, community centers, and organizations like the Red Cross offer CPR classes, so it's worth looking into. Finally, let's talk about prevention. One of the best ways to prevent choking is to be proactive. Make sure everyone who cares for your child, whether it's a babysitter, grandparent, or daycare provider, knows about choking hazards and what to do in an emergency. It's also a good idea to have a list of emergency numbers like your pediatrician and poison control posted somewhere easy to see, like on the fridge. And don't forget to regularly check your child's toys and play areas for wear and tear. Sometimes, toys can break and create small parts that can become choking hazards. If you notice a toy is damaged, it's best to throw it away or repair it if possible. Now, let's go a little deeper into some specific foods and objects that are common choking hazards. For example, did you know that even some healthy foods can be risky if they're not prepared correctly? Foods like raw carrots, apples, and celery can be hard for little ones to chew, so it's best to cook them until they're soft or cut them into very small pieces. Cheese can also be a choking hazard if it's cut into large chunks, so make sure to grate it or cut it into small, manageable pieces. Another thing to be aware of is food texture. Some foods, like peanut butter, can be sticky and hard for little ones to swallow. If you're giving your child peanut butter, make sure to spread it thinly on bread or crackers and avoid giving them a big spoonful of it. Similarly, foods like marshmallows and gummy candies can get stuck in their throat, so it's best to avoid these until they're older. When it comes to drinks, be careful with things like smoothies and milkshakes. While they might seem like a safe option, they can sometimes be too thick for little ones to swallow easily. If you're giving your child a smoothie, make sure it's not too thick and that they're sitting upright while drinking it. Now let's talk about non-food items. Small objects like coins, buttons, and batteries are obvious choking hazards, but there are also some less obvious ones to watch out for. For example, small parts from toys, like doll shoes or action figure accessories, can be dangerous if they're small enough to fit in your child's mouth. Always check toys for small parts before giving them to your child, and make sure to follow the age recommendations on the packaging. Another thing to be aware of is jewelry. Small earrings, necklaces, and bracelets can be choking hazards if they come apart. If you're wearing jewelry around your child, make sure it's secure and won't easily break or come apart. And if you have older children who wear jewelry, make sure they understand the importance of keeping it away from their younger sibling. Finally, let's talk about what to do if you're ever in a situation where your child is choking and you're not sure what to do. First, remember to stay calm. Panicking will only make the situation worse. If your child is coughing, encourage them to keep coughing to try to dislodge the object. If they're not able to cough, cry, or breathe, you'll need to act quickly. For babies under 1 year old, remember to use back blows and chest thrusts. Place your baby face down on your forearm, supporting their head and neck, and give 5 firm back blows between their shoulder blades. If that doesn't work, turn them over and give 5 chest thrusts using 2 fingers in the center of their chest. For children over 1 year old, use the Heimlich maneuver. Stand behind your child, wrap your arms around their waist, and make a fist with one hand. Place your fist just above their belly button, grab it with your other hand, and give quick upward thrusts. Keep doing this until the object comes out or until help arrives. And remember, It's always a good idea to take a CPR class. Knowing how to perform CPR can give you the confidence and skills you need to handle a choking emergency or any other situation where your child might need help breathing. So there you have it. Everything you need to know about preventing choking hazards in babies and children. It might seem like a lot to think about, but once you get into the habit of being mindful and proactive, it'll become second nature. And remember, you're not alone in this. Every parent and caregiver has to navigate these challenges, and it's okay to ask for help or advice if you need it. Thanks so much for watching, and I hope you found this video helpful. If you did, please give it a thumbs up and share it with anyone who might benefit from it. And don't forget to subscribe to our channel for more tips and advice on keeping your little ones safe and happy. Until next time, take care and stay safe. Bye.